So today's chapter is chapter 43, Epigenetics, Primordial Prevention, Preconception Care. Okay. Page number 549. Page number 549. If anyone is joining late, please help them out with the page numbers. So first is genonutrients. What are genonutrients? So these are substances that you find nutrients, okay, like antioxidants, anti-inflammatory agents, vitamins, minerals, okay, nutrients that are found in food and plants, which also have the ability to impact your gene expression, how genes will show up in your body, how genes will act in your body, okay, how genes carry the blueprint of how your body has to work. Okay. So this blueprint is affected with your nutrients. So that those nutrients are called genonutrients. Okay. The most common example is your antioxidants. Okay. All types of antioxidants, vitamin C, polyphenols, okay, vitamin B12, etc. So they all have the ability to switch off certain genes. If there is a cancerous gene that has been activated, these antioxidants have the ability to switch it off, to turn it off. Okay. So these are called genonutrients. Okay. What is epigenetics? These terms you have to understand the difference between this. So epigenetics usually deals with the effect of environment and other factors on our genetic phenotype. Okay. For example, you must have heard of it. People who are born in Hiroshima and Nagasaki after the nuclear bomb. Okay. People who are born there, they have some or the other form of genetic malformations. A lot of genetic diseases are seen post the nuclear attack, right? So there is some role that environment has to play. Okay, there is some role that environment has to play. So that's an example of epigenetics. Okay, how environment to which you are born has changed your genetics. Even you may you come from a family who does not have much of an ancestral history of certain diseases. Okay. Yeah, even Bhopal gas tragedy and all. So these all comes under epigenetics. Okay. Your parents may not be diabetic at all, but your after their marriage, your parents may have moved to an urban city. Okay. And you were born and brought up in an urban lifestyle. You had extreme access to food. Okay. Rich food, uh, junk food and all. You had much more access to that. You didn't had access to clean air as compared to rural environment. Okay, you were born and brought up in an urban environment. Even though your parents may be fit and healthy, they may not have any respiratory diseases running in the family. They may not be diabetic, but you as an individual, will you have the risk of developing these diseases? Your parents did not, but right now you are planted somewhere else. Okay, where you are planted right now, or where you have been planted, where you have been growing up. Okay, those areas will also have an impact on what kind of disease conditions you will carry. And why it is called epigenetics? Now this person who is born and brought up in a urban scenario, okay, with all the good and the bad effects of it, tomorrow when they will start having a family, they will carry on this disease condition towards their children as well. Okay, so genetic modification has take place, like that certain genes switch on and switch off has taken place. Okay, so this is epigenetics. It is a relatively new area of scientific research because still now the research is going on how different environments, what kind of diseases we are putting or we are exposing our new generations to. Okay, what kind of influences and experiences our children are having, the past generation, present generation, what are they having, what influences they had, and how it shaped them as an individual in terms of their health. Okay, in terms of what gene expressions they have. Okay, to study this is called epigenetics. Okay, so during development, the DNA that makes up our genes, it accumulates certain chemical marks. Okay, it has been exposed to maybe a lot of pollution, some toxins. Okay, some byproducts of your metabolism. They all have mark. They all have some marks on your DNA. Okay. Over a period of time, when the DNA has gathered enough and more marks on itself, that it is ready to shift, now it is ready to change into something. This is what we call as epigenetics. Okay, because your experiences shape you as a individual. What you have experienced shape your health, your emotional health, your social health, your physical health as well. Okay, all these aspects of health are come into being based on your experiences and exposures. Okay, a child who was frequently traumatized in the growing up stage, okay, may have anxiety issues, stress related issues when they grow up as an adult, because they were exposed to a traumatic environment, a harmful environment. So their emotional and mental health got affected. It's not just the physical health, okay? All the dimensions of health, anything can get affected based on what experiences and exposures you had as a child. Okay, this is epigenetics. Is it clear to all? So epigenetic modifications can affect genes. They have given you some type of epigenetic information that is too that will be too difficult for you to understand. So leave those points. Okay, types of epigenetic information. The way how different external factors change the information in your DNA. Okay, that is not required. How do epigenetic modifications affect your genes? Okay, because as I mentioned earlier, genes, they have the blueprint, okay, of making your cells act or work in a certain way to help your cells make proteins as well. Okay, so the DNA sequence of a gene is transcribed into your RNA, which is then translated into the sequence of a protein. Okay, so goes on like that. RNA will make sure how the DNA has to work, because RNA is just one strand. DNA is the double helix strand. Okay, so every cell in your body has the same genetic information, but certain genes in certain cells may have too much of a marker of certain toxin or a certain type of exposure. Those specific tissues and cells will act differently. Okay, starting from the zygote form, when you are a zygote, you are still in the cellular phase. Okay, organs have not yet formed. Even in that state, majority of the genes have already begun their expression. The way how you will grow up, the way how what kind of nose, eyes, uh, lips you will have, the grow will the baby will have within the womb. Okay, that everything gets fixed during the zygote phase itself. But along with that, if there is any uncontrollable chaos in your gene expression, okay, you are exposed to severe conditions, traumatic conditions and all, okay, and if there is any uncontrollable chaos, that could lead to some ill differentiation, okay, or bad differentiation, and that would lead to some disease condition. So this is the reason why automatically certain genes, okay, when you are in the zygote form, certain genes has to switch off. Otherwise, if they keep multiplying excessively, the child will be born with lots of tumors, right? After a certain growth, the genes have to slow down their multiplication, right? Otherwise, there will be an unnatural multiplication of genes and cells and whatnot, and it will lead to some tumor and other disease condition. And also, there are different kind of epigenetic marks. Okay, not every toxin will put the same kind of mark on every DNA. Okay, so there are some specific sequence of the DNA where it can put its mark. The other sequences it cannot. Okay, the sequence of the DNA also plays an important role. If there is any variation in the DNA sequences, those sequences have a higher risk of getting marked by any toxins or other exposures. So genetics, you can see here the difference. Genetics, your DNA has certain sequences, okay, that regulates the way how your body behaves, how your gene behaves, okay, and that shows a phenotype in you. Okay, you may have a height of a certain length, okay, weight of a certain kilograms, body shape, eye color, hair color, skin color. These all are your phenotypes. It's because of the DNA sequence that you have. Okay. Other than that, your environment, where you stay, the food, your supplements, your air, water, your type of rest, your type of routine schedule, okay, your mental health, areas affecting your mental health, all these things will cause some genetic modification. Okay, epigenetic modification is changing some of the aspects of places where you live, the lifestyle that you have, and that can also lead to gene regulation. And that gene regulation can also lead to giving you a desired phenotype. So usually how the epigenetic modifications work on genes, they imprint, okay? They imprint what they want the gene to act as on certain areas of the DNA, which is viable for imprinting, okay? So that's how epigenetic modifications can come forth into your phenotype. Next is primordial prevention. It is before primary prevention, primary care, secondary care, tertiary care. You must be available of, you would know that, okay, different types of care. But even before primary care, there is a primordial care, okay. There are various levels of preventing diseases or curing diseases. Usually we study about the primary, secondary, and tertiary. But right now, there is a more stress on primordial as well. Primordial, which means based on having the knowledge of your own family dynamics, your own family tree, keeping that knowledge in mind, you take conscious decisions towards maintaining a good health throughout your life. You want to maintain the health. Disease has not yet started, okay? But you start maintaining yourself, avoiding risk, okay? For example, both the sides of the family, if obesity is there, the person right now, the generation right now, will from a very young age itself, they will try to maintain a proper weight, okay, because family may usually comment, okay, everyone on your families, both the sides, they are on a healthier side, you will also get, or you will also put on weight after a certain age. So with this information, what you can do, you make sure that you always maintain a appropriate weight, okay, you control your dietary intake, you stay physically active, okay. If everyone in your family suffers from high blood pressure, Okay, you make a conscious decision to reduce sodium in your diet, to have live a stress-free life. Okay, glucose as well. If anybody is diabetic in your in your family, both the sides. Okay, you cut down sugar in your food. You focus more on complex carbohydrates and so on. You don't indulge in smoking, drinking, taking these measures so that or taking all these measures so that you know that drinking and smoking is a risk factor for so many diseases. Let's avoid it altogether. Okay, not having junk food from outside, always having meals cooked at home. Okay, having salads on a daily basis. Okay? These all are some primordial prevention. Even before having eliminating the risk, making sure you leave the choices that you make on a daily basis takes you towards good health. So in primary prevention and all, you know that you will use some medications, okay? Some you will if you are smoking, after knowing the risk factors of it, you will make sure that you stop smoking. Once you get to know that your blood sugar is high, after knowing it, you maintain it. Okay, here some signs and symptoms will come into your life, and then you make a choice. That is primary prevention. Okay, secondary is now the disease have started. It's not that severe, but it has started. You do not want to make it more severe. So whatever steps you take to control your disease, because now you are in a disease state, to control your disease from deteriorating, that is secondary prevention. Tertiary is minimizing the impact. Okay, you may have gone to a severe stage, but you don't want to die, or you don't want to uh, be a burden or suffer even more. Okay, to and here treatments are given, surgical treatments, some devices put. Okay, getting rehabilitation done if you are addicted to something, these all comes in the tertiary care. So these are the different stages of prevention. Primordial is maintaining, avoiding risk in all ways possible, usually based on your genetic counseling information. Next is preconception care. Before conceiving, before getting pregnant, what type of care mothers should have. Okay, so usually it's for nutritional conditions and all. Right now, even right now, if the mother is not pregnant yet, she's planning. Okay, next year I want to have child. Right now, let me plan for a good health so that my body is capable of sustaining a pregnancy full term. Okay, a healthy pregnancy full term. Okay, so what woman has to do for this? So first she will get screening done for any anemia or diabetes. Okay, because correct that. Yeah, also PCOS, women who have PCOS, they have to be very vigilant about their preconception care. Okay, PCOS and depression. See, why depression is commonly seen among teenagers is that they are finding new emotions within themselves. Okay, and that is also hormonal fluctuations that takes place. Okay, this is also an age where you want to be accepted by the people around you, your peers and all. Okay, you may have lot many expectations which are not met. Okay, that these are the reasons why depression is more common among teenagers. Okay, lot many physical changes at a physical and a mental level is taking place during your teenage life. So, according to the nutritional conditions, screening for anemia and diabetes is done. We'll discuss in detail. The supplementation of iron and folic acid is done so that you correct your anemia. before you get pregnant. Monitoring of the nutritional status, correct any minor micro deficiency, macro deficiencies. Energy and nutrient dense food if required, if the mother is below 45 kg of weight. Okay, at least the woman should be of 45 kg of weight. Otherwise, there are high risk that the woman will give birth to a low birth weight baby. Managing diabetes, counseling people with diabetes, promoting exercise. Okay, you promoting the use of iodized salt or fortified salt. These all comes under components of preconception care. So there is a checklist for it given in your textbook. So based on that, you can cover all the points. So when it comes to education, what kind of education you will give to women who are planning to get pregnant? Avoid smoking, drinking, okay, other drug use. Start taking folic acid supplements. Don't wait to get pregnant and then take. Okay, because the neural tube, it has to close within the first 2 months of pregnancy. Okay, you start taking folic acid after 2 months, there may be already some defects taking place. Okay, at least 400 microgram daily. Then counseling. What kind of counseling you will give to pregnant mothers about STDs, HIV? Okay, if a mother is suffering from HIV or AIDS, what are the chances that the child will also have it? Okay, family planning, um, pregnancy spacing. Okay, at least if you're going for a second child, wait for next 6 months or at least one more year for your body to recover and then plan for second child. Like that, you can give the counseling. Healthy body and weight based on their height, diet, oral health. What are the risk of hepatitis, especially with women who have tattoos and body piercings and all. Genetic disorders which are running in their family, like cystic fibrosis, sickle cell and genotypes and all. So to give counseling regarding that. Assessment, checking the height, weight, talking in detail about family history, medical history of the family. Okay. Carrier screening. Some people have certain diseases. Some races have certain diseases running in their genes. Okay, based on their race, ethnic background, family history. So screen, are you a carrier to certain disease or not? Because if you are a carrier to a certain disease, and even if your partner is as well a carrier of the same disease, there are high chances that the child will also have the same disease. Okay. What are the complications with past pregnancies if they had any past pregnancies? Okay, like postpartum hemorrhage, gestational diabetes, RH incompatibility. The mother is having A positive, the child is A negative. Okay, the child she's carrying is A negative. It could be like that. So the child will get attacked by the mother's immunity. Okay, so it's like that. So that is RH incompatibility. Preeclampsia, eclampsia. Okay. So assess the woman. Did you had any previous pregnancy? Did they have any serious risk during a previous pregnancy? Check if they are victims of domestic violence, sexual violence, and give them counseling. See if they're ready to be a parent. Okay, some women under the pressure of their family, they agree to uh, conceive. Okay, but that readiness should be there. Okay, nobody should force anyone, the men or women, anyone to become a parent. Okay, it's a big responsibility, especially for women. It takes a lot from her physical, mental, and social health as well. Okay, so as a screening that if the woman is ready to be a parent, then some screenings that you have to do. Behavioral screening. Are they alcoholics? Okay. Are they victims of domestic violence, drug abuse? Do they abuse any over-counter medication, addicted to certain medications? Did they had any previous abortions or miscarriages, smoking and all? Chronic diseases, are they suffering from asthma, diabetes, heart disease, hypothyroidism, obesity, oral health? Okay. Genetics, do they have any cases of cystic fibrosis in their family? Maternal phenylketonuria, PKU, phenylketonuria, and sickle cell anemia. These diseases are, is it running in their family? Are they taking any medications? What kind of medications? Okay, like thyroxine, thyroid medication and all. About sexually transmitted diseases, STDs, HIV, hepatitis B, C, gonorrhea, chlamydia, bacteriosis, vaginosis, cervical cytology, syphilis. Okay. Then vaccination, are they vaccinated for HPV, human papillomavirus, influenza, varicella, rubella? Okay, are they vaccinated for all these vaccines or not? That you have to assess. So these will be the main areas of preconception care. All these areas have to be given for a woman, or all these areas has to be checked in a woman before she becomes pregnant. Okay.